Good day everyone, I'm John Mark Osido, student from Radio Fatima University College of Nursing. Today I'm gonna show you the parenteral administration subcutaneous injection return demonstration. So let's go. So to start the procedure, we need to check for the MAR of the patient or the medical administration record. So checking the MAR of the patient means we need to check the medication if it's the same as in the record of the patient. So check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. After check, follow 3 checks of administering medication. Read the label on the medication when it is taken from the medication cart. That's the first. The second is before withdrawing the medication. And the last is, or the third is after withdrawing the medication from the vial. Next is we need to organize the equipment that we will be using when we are performing subcutaneous injection. So the first one is the PNSS. The injection pad serves as the skin that will be injecting the medication. We will be using 1 cc syringe since we don't have any insulin syringe. So we will be using this one. The next is the aspirating needle. So aspirating needle is needed for drawing the liquid from the vial. Next is set of cotton balls. First one is soaked in 70% alcohol solution and the other one is plain clean cotton ball. The medication tray. This is where we will put all the equipment that we'll be using in subcutaneous injection. And next is a pair of gloves for our protection. Lastly, waste receptacles for the used syringe and other used materials. After organizing all the equipment that we will be using in this procedure, we need to perform hand hygiene and observe other appropriate infection prevention. For example, preparation of our gloves. Next is we need to prepare the medication from the ampule or vial for drug withdrawal. So we will be needed here now our medication, or this one, then the 1 cc syringe and the aspirating needle. So to prepare for the medication, so open the pack of the syringe. Again, remember we will only touch the barrel of the syringe and to avoid contamination of the needle. And then I will replace the needle into aspirating needle so that we can draw the liquid from the ampule or vial. So now I already placed the aspirating needle, so I will be drawing the medication needed in the vial. So as I check the MAR of the patient or what's the doctor's order, we need 40 units of liquid from this medication that we will be injecting to the patient. So we will draw 40 units we need to convert it into cc. So 40 units is equals to 0.4 cc or ml of this syringe. So we will draw 0.4 ml of air. Now yeah, and then remove the cap of the aspirating needle or the syringe. Insert it in the medication vial. Then insert the air that we draw. And now we will draw the recommended units that we are need for our subcutaneous injection. Okay. Make sure that there are if there's an air bubble or we will just plunge it so that the excess air will come out. There you go. Okay. Then after withdrawing the medication from the vial, we will remove the aspirating needle and connect again the right size of needle that we needed in subcutaneous injection. So I will remove it, and then I will connect the right size of needle. Here it is. Now we're done preparing the medication for subcutaneous injection. After preparing the medication that we will be using in this procedure, so we need to prepare the client. So prior to performing the procedure, again introduce yourself and verify the client's identity. So it goes like this. Sir, my name is John Marocido, your student nurse today. May I know your name and your birthday? After you introduce yourself, verifying client's identity and providing privacy for the patient, assist the client to a position in which the arm, leg, or abdomen can be relaxed on the site to be used. Obtain assistance on holding an uncooperative patient. So next is explain the purpose of medication and how it will help using language that the client can understand. So next is include relevant information about effects of the medication, and then select and clean the site. So since we don't have any model to do the procedure, so here's the sample injection pad. So commonly subcutaneous injection is performed being used in abdominal part of the patient. So in an abdominal part of the patient, so select the site free of tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation. So example, let's imagine that this is the abdomen part. Then select the site that has not been used frequently and then apply gloves. So we will apply gloves. Then select set, clean with antiseptic swabs, starting at the center of the where the site and widening outward. So, and then allow the area to dry. So we will use the cotton ball soaked in 70% alcohol solution. So from center outward. Hold the swab between third to fourth fingers of the non-dominant hand or position the swab on client skin above the intended site. So I will be putting the dry cotton ball into my non-dominant hand. It said that it's in third to fourth finger, so I put in the fourth finger. So next is prepare the syringe for injection. Is remove the needle cap while waiting for the antiseptic to dry. Pull the cap straight to avoid contaminating and the needle by outside edge of the cap. And then in injecting the medication, grasp the syringe in your dominant hand, and by holding it between your thumb and fingers like this, and with palm facing the side of upward for 45-degree angle insertion, or with the palm downward for a 90-degree. So it's either 45 or 90-degree angle before injecting. Using the non-dominant hand, pinch or spread the skin where you insert the needle using the non-dominant hand, and firm steady push. Recommendations vary about whether to pinch or spread the skin and at what angle to administer subcutaneous injections. So the most important consideration is the depth of subcutaneous tissue in the area to be injected. If the client has more than 1/2 inch of adipose tissue in the injection site, it would be safe to administer the injection at 90-degree angle with the skin spread. So if that's the case, if the client is thin or lean and lacks adipose tissue, the subcutaneous injection should be given the skin, pinch, and at an 45 to 60-degree angle. One way to check that pinch the skin is subcutaneous tissue to ask the client to flex and extend the elbow. If any muscle is being held in the pinch, you will feel contract and relax. If so, release the pinch and try again. So let's say that the patient is thin, then we will pinch the skin part, and then we will inject it into a 45-degree to 60-degree angle. Inject, and then pull the same angle we inserted. Then apply the dry cotton ball. Do not massage the area. Apply gently pressure on the area. Put the used syringe on the waste receptacle, proper waste receptacle, to avoid finger injury. That's all. So this is how you do a subcutaneous injection. After performing subcutaneous injection, so discard the gloves. And then do a proper hand washing.